Have you seen like an increase in like mental health uh,
Yeah.
problems in kids?
Yes, and a great point. You make a great point there, because it doesn't stop when you leave. And I have three older, uh, children. My youngest now is a senior in high school, and two in their 20s. So yes, you're right, and I do see that, and I see how that becomes an issue, not when they just leave school, but although that needed to be addressed back in the day as well. But as far as the mental health component, absolutely, absolutely. You throw in these last few years with COVID and I don't want to put it all on COVID because I don't think it is all COVID, but when we were home for a year and really we need those phones are what kept children and adolescents and all of us engaged. And thankfully, there was some great engaged though with each other, with our friends, with our peers, not maybe the social media didn't serve its role, but at least as far as the engagement with others. But yeah, yes, when it comes to the mental health crisis, the well-being, I'll say the mental health well-being in general definitely is a concern. And I think there's a little bit though where I applaud the fact that people are more willing to recognize it. This is a different time, and I think it takes a lot, and I think it's more easily, I don't want to use the word accepted, but brought up and understood that it's an issue and there are things to address it, which I think is so valuable when I have a younger teenager or a preteen who, gives me the clues that are directly saying that I need some help. It takes a lot to do that, and I certainly applaud it. But kind of getting back to your question, yeah, the mental health crisis. I don't know if I want to use the word crisis, but the mental health well-being is definitely a tremendous concern and issue. Our children are facing these days.
Yeah. What are some of those cues that you're talking about of a child saying like, I need help, something is wrong?
So there are questions that it depends on the type of, what type of visit is. But at my routine well child care visits, I'm comfortable saying that, I'll ask questions about their mental well-being. There are forms that sometimes we'll use and questionnaires that we can use, but also there'll be things about school, and specifically looking like at depression or depressed moments or anxiety. Now, I think it's pretty common. Everybody's got a little test taking anxiety. I haven't met many, and I've been thinking about this closely. The last couple of weeks, I've been asking my patients, and everybody's got a little bit. I remember having a little bit. But when it comes to depression, as far as feeling sad, as simple as just asking, are there moments where you are feeling uncomfortable about a situation, whether it be at home or school, with your friends, really tackling it, not tackling it, but really addressing it from all avenues of one's life. Sadness is an emotion. It's an acceptable emotion, but it's how you respond, how you bounce out of it. And there are some who say, yes, I do feel sad, but I bounce pretty quickly. I can talk to mom, dad, and it's quickly. And there are others who say, I have a hard time finding a way out. Now that's pretty direct. But that is a child who if is not already receiving some assistance or help, it's time to find some. And, at that point, we, figure out a plan in order to address that.